Here in America, health care is a right for all, not a privilege for a few. So come January, we're going to work quickly with the Congress to dramatically ramp up health care protections, get Americans universal coverage, lower health care costs as soon as humanly possible. We want every single American to know, if you're sick, if you're struggling, if you're worried about how you're going to get going to get through the day, we will not abandon you. That is a promise.
That was Joe Biden speaking out last week on the Affordable Care Act, commonly known as Obamacare. It came the same day the Supreme Court heard virtual arguments against the Health Care Act, challenging protections for pre-existing conditions and premium subsidies. The court is expected to announce its decision on constitutionality in late spring, as Joe Biden has made health care a key issue in his campaign. My next guest is considered the key architect of Obamacare, as well as the Massachusetts Romneycare health care reform. Joining me right now is MIT Ford economics professor and the author of Jumpstarting America, co-author Jonathan Gruber. Jonathan, it's good to see you this morning. Thanks so much for being here.
Thanks for having me, Maria.
So where do you think this is going in terms of the Supreme Court, Jonathan?
Well, look, we have to start with the fact that literally every expert, including the lawyers who brought previous cases against the ACA, think this is a stupid case. It really has no merit. And fortunately, it looked like the oral arguments supported the fact that at least 5 justices, or at least the key justices, Justice Roberts and Justice Kavanaugh, agreed that there's simply no reason, regardless of your feeling about the mandate, to take down the whole law based on the constitutionality of the mandate. So hopefully, based on those arguments, the court case will go away and the ACA will stand. So I'm feeling pretty good about that. If it doesn't, we're in big trouble. The ACA is in big trouble because with Republicans, as long as Republicans retain control of Congress, it's going to, or at least one house of Congress, it's going to be hard to put in place a replacement for the ACA.
Jonathan, what about those people who right now have insurance through their company, 180 million people who have their private health insurance, and they don't want that to go away?
Well, that's absolutely right. So basically, if you think about the way that the Affordable Care Act is really intertwined with our healthcare system in many ways. First of all, if for the 180 million people employer-sponsored insurance, as we discussed before, Maria, the Affordable Care Act doesn't play a huge role. It does play a small role, because it guarantees that their employers have to offer them real insurance coverage. They can't offer them coverage that, for example, has an annual limit so they can go to a hospital stay, end up with a huge bill. But by and large, for the 180 million Americans with employer-sponsored health insurance, the Affordable Care Act didn't much affect their lives. And whether it goes away or not will not have a huge impact in their lives. I think for those people, the real issue is how do we control healthcare costs?
Right. So how do we control healthcare costs? That's one of the most important issues. I agree with you.
It's a really critical issue, Maria, and neither party has a brilliant answer on it. It's the hardest issue in some sense, ironically, given the 12 years of battle over the Affordable Care Act. Ironically, that was the easy part, because that was mostly about coverage. Coverage is about spending money. Cost control is about saving money. That, as you know, in Washington is the harder part. And that means taking on some individuals who are making money on the healthcare system who maybe will have to see their incomes fall if we control healthcare costs. It means revamping a system where a lot of parties have a vested interest in not letting it change. And that's the fundamental political challenge that we face when we try to control healthcare costs.
Okay. Let me ask you about Georgia, as control of the Senate will be decided by those 2 runoff elections in January, Jonathan. If both Democrat candidates win, the Democrats gain control of the Senate. What do you see happening in terms of health care?
Well, I think if the Democrats gain control of the Senate, I think Joe Biden has laid out 3 things he'd like to get done. The first thing is he'd like to expand generosity of the subsidies on the exchanges. While I'm a big believer in the ACA exchanges, they simply aren't generous enough for people who are low income. You can end up spending more than 20% of your income on health care if you on the exchanges. And so Biden would end that. He would both make them more generous and he'd make them available with subsidies to everyone, not just those below 4 times the poverty line. That is not very politically controversial. That's just a budget issue. Republicans, I think, don't want to spend the money. Democrats would be willing to. So that's simply, it'll happen if Democrats control the Congress. It won't if they don't. The more controversial piece is the so-called public option.
Yeah.
Yeah.
Yes, go ahead.
Is the
Tell me
public
about
option.
the public option. That's what I was just going to ask you about. Go ahead.
Yeah. So the public option, Maria, let's separate out two aspects of the public option. I call them the public option light and the public option heavy. The public option light is having a government-sponsored insurance plan that's just like any other insurance plan. It's just another option on the exchanges. The advantage of it is having that on there, and let me be clear, without government-regulated rates to providers. Okay, that's the difference between light and heavy. Public option heavy is having something like Medicare, which regulates the rate providers are paid. The big difference is public option light, the big advantage of it is it offers some more competition on the exchanges, which is good. But most importantly, it offers a route to bring coverage to the millions of Americans who've been denied insurance in states like Georgia and Texas and Florida, where the federal government has offered to pay 90% of the costs of covering their lowest income citizens with insurance. But their state legislatures and governors have turned it down selfishly. Okay, so that's the big game there. The public option heavy, that's another step, because that would involve regulating rates, and that will be opposed. That will be opposed by insurers who will feel like it might eat into their business. It'll be opposed by providers who might be worried about getting lower rates.
Yeah.
So that's going to be a heavier political lift. I'm not sure just having 50 in the Senate's enough. I'm not sure that you can get every single Democratic senator to support that. I think that's going to be more of a battle.
Well,
but I think it's very important to remember.
Jonathan, we've talked about this before. Yeah. Go ahead.
When you say public option, yeah, very important to remember. Say public option, there's two aspects. There's the regulating the rates, but there's also offering a route to the millions of low-income Americans who've been really just spitefully denied health insurance by their governors and state legislatures.
Spitefully?
Spitefully, because really, Maria, take a state like Florida, okay? There's 1 million uninsured low-income people in Florida. The federal government has said to Florida, we will send you billions of dollars to cover the 1 million low-income uninsured in your state, okay? And Florida said no. Out of nothing but spite, nothing but pure political calculation. Okay, this is the rest of the country saying we will send you money, Florida, to cover your low-income citizens, and Florida saying no. How can that make sense?
Well, I know who's upset about it. I know who's upset about it, business, because they feel that it's way too expensive. And that is one of the reasons that they've had to pull in money on other things like raising salaries or investing in IT or investing in our R&D.
Maria, I totally agree, and we want, you and I agree. I'm so glad you liked my book, and we agree businesses spend more on R&D outside the government. But this is a separate issue. This is literally the federal government saying, we will. Now, I can imagine voters in other states not liking Florida.
Listen, let's be clear. We don't agree on everything. Jonathan, we don't agree on everything, but we agree on some things. And I'm glad you're here today. Have a great day, Jonathan. Good to see you, sir.
Thanks, you too.
We'll talk soon. Jonathan Gruber.